We're going to now move into the Q&A part of this webinar. Remember, you can turn to the questions box, should be on the right side of your screen here in GoToWebinar, and you can start entering your questions. We've already received a few over the last 40 minutes, and moderating our Q&A is Deb Wackenheim, who's the Assistant Director of Research Dissemination for OpenNotes. Deb, what are we seeing in the questions box?
Okay, so a couple questions first for Maria. Are the EHR systems used in primary and secondary care in each region common, even if different between the regions? So within a region, are they the same?
Yes, in most regions they are.
Okay. So then you did, this question came in pretty early in your presentation, and you did touch on this towards the end, but if you want to say anything more, this person wanted to know more about what isn't shared, such as mental health and pediatrics. If those areas are routinely shared, have there been any adverse effects?
So there are, there is sharing of mental health records. There is also sharing of pediatrics records. There hasn't been any sort of major issues. Some anecdotal that we hear of, but not. There's no. To be honest, there isn't really much research into or data on adverse events, but there hasn't been a huge. It's been similar sort of non-events as when OpenNotes is introduced in other areas. It doesn't. There's a lot of worry beforehand, but then things sort of run quite smoothly. There has been some reports of, especially in mental health care, that clinicians feel that they can't document everything, that they keep things out of the record, which would of course be a big problem, a big issue. But there hasn't yet been, this has been sort of subjectively reported and not confirmed. So,
and Selina, I don't know if you'd want to add more on that topic as well, mental health and adolescent notes, and if you've seen any adverse effects.
Yeah, I think, you know, there's probably always going to be case-by-case basis. We don't see a lot of adolescents in our environment, and we don't have pediatrics. But I do know that from what I have seen, some of the, or many of the clinical teams really do try to focus, and they try to make improvements within their own environment. So, you know, they do look within their own program areas at how to improve, how to communicate with the patients, and have internal discussions about how to improve their documentation as well.
And then the next question was directed to Maria, but I think it'll be interesting to hear both of you respond. Sweden approached the COVID-19 pandemic quite differently than many other European countries. How has this approach impacted, if at all, the use and dividends of OpenNotes? So Maria, if you want to talk about Sweden, and then Selina, if there's anything relating to COVID and OpenNotes that you want to talk about. Go ahead, Maria.
That's a bit of a difficult question to answer. I'm not sure if it has affected how we use OpenNotes or how we access our records. Similarly to what Selina described, of course, we see that there has been a lot of testing of COVID and antibodies, and we do access those results through the patient portal. So it definitely, there has been an uptake in the adoption has increased, similarly to what Selina presented from Canada. Of course, since we've had, we haven't had as strict a lockdown as other countries. Now, I have to admit that I was visiting OpenNotes in Boston during the worst of the pandemic, so I wasn't actually living in Sweden at that time. But of course, we've instead had quite strict rules about isolating at the mildest symptoms of a cold, which means that people have been a lot more on sick leave and working from home. So, but whether or not that has impacted how we use OpenNotes, I don't think so.
Yeah, and then it's Selina. I'll also add, you know, I don't have actual data at this time to see what is happening to the notes themselves, but of course, with the pandemic, you know, our patients and staff are being tested, so the access to the COVID-19 results are important, and there's definite urgency in seeing that. I think what we also have been hearing is that because of the virtual care environment, which is very high now, patients are not coming into the hospital. They may be getting tests outside. They may be getting care at other organizations as well. So that's why having that access to that information is so important, right? And that's about that patient empowerment and making sure that access is available.
Maria, there was a question about what type of information patients input into their medical record.
Not much at the moment. I mentioned that there's something that we call the patient's note, and this is a very rudimentary function where on a note in the record, you can activate a function so that you can write a comment on this note. You can't write your own notes independently of what is in the record, but you can comment if you sort of want to clarify something, or you feel that there was a bit of a misunderstanding, but it's maybe not enough to report, or you just want to make you know, a memory, a note for yourself. So I have, for example, used it for myself in between visits, just to note down things that I want to remember to bring up at the next visit. But it's a very short free text box. It's not much data going in there at all. And it's very, you have to activate it every time. It's been designed not to be used. So I'd almost prefer not to talk about it because it's a bit embarrassing. But hopefully we will be able to redesign this and make it more useful to both patients and clinicians.
And here's an interesting question for both of you. Any evidence that sharing medical notes has increased patients' health literacy?
We don't actually have evidence for that, not that I'm aware of. We have sort of asked questions whether patients find the record difficult to understand. And most people, at least who responded to our survey, said that they did not find it very difficult to understand, although they also said that there was a lot of medical terminology. But I think that many people sort of understands their notes a little bit based on the context, and you know what you were seeking care for, and when there's a few of those difficult words, you look them up. So there hasn't been, but on the other hand, we haven't necessarily heard from those patients who might have the lowest health literacy. And they are likely the ones who do not actually access their records as well. So but this is a really interesting topic that would be very interesting to explore further.
Yeah, I would agree with Maria. I don't think there's a lot of literature, and definitely for UHN, we have not done some, in-depth studies about health literacy. What I do know, and this is more anecdotal, is that I have heard from patients that initially, when they look at their notes, especially, they do have challenges on what it means. Within our portal, we do try to provide a glossary of terms. We have an acronym library as well, so patients can look it up. But I think over time, and especially because our clinicians know that patients are looking at those notes, we're seeing that there's a genuine attempt to improve, that documentation. And I remember from one patient, he had said to me, I may not have understood it at the beginning, but now, even though I may not know every single word, I generally understand what what they're saying in my notes. So I think this is an evolution, this is an iteration. We're not going to get it perfect the first time, but it's a way for both patients and our clinicians, our care teams, to learn together and to actually sort of see what the benefits would be and how to improve as well.
So another question for both of you. One of the top concerns we have been getting is about immediate open results. How best do we handle the situation where patients are likely to receive cancer biopsy results before their provider sees them in the EHR?
Maybe I can answer that first. I did refer to some pieces of advice during the presentation that you could refer to there. We also found it important. Originally, when we launched with our portal, what we found was that our clinicians are busy. They're all day in the clinic, they're doing surgeries, etc. So a lot of times the patients do see the results first because they get notifications as soon as it's available. And what we had to do during the course of the implementation was that we actually sent alerts to the providers right away if any results looked abnormal, so that the providers had an opportunity to look at the results. I think in general, what we heard from patients was that they don't expect the provider to kind of look and have a plan right away, but they do want to have some kind of sense of relief that somebody does know about it, and that there will be plans to contact them and to follow up for a next visit. Maria, I don't know if you have any other insights from Sweden.
No, but the same concerns, of course, have been raised in Sweden as well. And the regions have taken slightly different approaches to, whether you should have a sort of 2-week embargo or whether you should have immediate access. Most are now moving towards immediate access, as is also recommended in the regulatory framework. We have done studies with, for example, there's been a very interesting interview study with cancer patients who, 15 patients who chose to read their record and 15 patients who chose not to read their record. And, their rationale for doing either or. And I think for many, it comes down to a very personal choice. And many of the cancer patients who chose to read their record, even though they might be expecting bad results, or they explain this as the wait is one of the worst things when you're expecting. You know that it could be good news, it could be bad news. And many of them felt that they preferred to receive the bad news at home, maybe alone, maybe being able to break down and cry, wrap your head around your thoughts, prepare for the meeting with the clinician, have your questions ready, rather than sort of being in a very, stressful place and just going into shock in an appointment with a person you may or may not know very well. So it's also, I think that we sometimes take for granted that some ways are better to receive results. That may not always be what patients prefer. Of course, those results, when you are completely sort of blindsided by them, you were in for a routine appointment and then all of a sudden it turns out that there was something very serious going on. Those are more difficult. But I also think that, and this is my sort of personal reflection, is that sometimes we idealize the way that bad news is delivered today or without OpenNotes. And we sort of envision this ideal image of how patients receive bad news today. Whereas the truth is that many of us have sort of, that missed call, you realize something is wrong, you have to come, you're called to an appointment, you have to come to the hospital, perhaps bring a family member, and then you know it's bad news beforehand, but you don't know how bad, or, you know. So I think sometimes we idealize the way that that news is delivered outside of the record. But of course there are, it's not a, bad news is never what you want to get, regardless of if you read them in your record or if your physician tells you. So.
Thank you. A question that maybe Kate DeRoche would want to take first, and then if Maria and Selina have any other thoughts to add. Have you broken down OpenNotes use by racial / ethnicity populations?
I can, excuse me, this is Kate, I can try to answer that. So we have survey data that and we did ask the race and ethnicity of the respondents, but it's not really, I would hesitate to say that that's reflective of the whole population, because it's only people who were getting their care at these individual institutions. So I can say that what we've seen over the last few years is a growth in safety net organizations opening notes to patients. So for example, LA County Department of Health shares notes now, and OCHIN, which is the EHR the EHR provider for federally qualified health centers, they also have all of their clinics are sharing notes. So we know that it's growing. It's a little bit hard to walk that back, though, to a proportion of the population, because we know still that people who identify as a racial or ethnic minority are both less likely to be offered access to a portal, and when they are offered access, are less likely to use it. So I would say that there's still a little bit of a kind of a black box happening there. What we do know from our surveys, though, is that patients who identify as coming from a sort of traditionally underserved population, racial or ethnic minorities, people with limited English proficiency, they do report benefits from reading their notes at a higher, they're more likely to report benefits from reading their notes than patients who are than white patients or patients with higher levels of formal education. So it is beneficial for them, but we can't really say much about the proportion of each racial or ethnic group that's reading their notes.
Selina or Maria, do you have anything to add to that?
I guess within the Toronto region, we do have a very diverse, demographic. There are many different cultural differences among the different regions. I think for our portal, we have never studied sort of the breakdown of who is actually accessing and what those demographics are. I suspect that health equity, access to services is going to be even more important, and we are seeing that now, even with the pandemic, right? So, kudos to OpenNotes for doing all of this wonderful research, and I hope that in the future other organizations will follow suit as well.
So I think we have time for one more quick question. Maybe we have 1 minute left. On the aspect of understanding case notes, is there any evidence that the format and clarity of the notes has improved? In the UK, case notes have a really high and wrong use of abbreviations. To make case notes patient-friendly, clinicians would need to use acronyms less. So if either of you want to talk about, has there been any work to improve notes to make them more patient-friendly?
Yeah, there hasn't really been that work, I think, in Sweden, although it is encouraged, and there are, some work probably trying to address that. We do have in the patient data law since the 70s, it states that the record should be written in a way so that the patient could understand it. But we also have a lot of abbreviations and things that may be less easy for patients to understand in our record. So it's not really been followed.
Yeah, and I think if there are any vendor technology or technology vendors in the audience, this is an opportunity, I think, and we are seeing that in many health information systems that there's more standardization in the way our providers are documenting the notes, and ideally in the future we should be able to see parts of it where it is sort of a translation in a sense to communicate better to our patients, to provide the summaries as well, in addition to that detailed information. So there's so much improvement that could be made. And again, I think in the future, we'll also start to see the opportunity where patients can start to contribute as well and interact with their notes, with their data, to self-report, to upload information. So there's so much opportunity in the future for improvements.
And on that note, pun slightly intended, we are at time and we're going to close things down. Thank you so much to today's presenters, Selina Brudnicki and Maria Hagglund. You guys were fantastic, and I think so many folks are going to leave today having learned a lot. We've had many attendees on today's call and a ton of questions. We are capturing everything. We will be posting this recording up on our YouTube channel very soon. And since you were here today, you'll definitely receive an email with a link to that recording, which you can share with any of your colleagues anywhere you want to put it. Thank you everyone so much. If you have any questions or want to know what's going on with OpenNotes right now, definitely visit opennotes.org, sign up for our email list, which I think you're actually now on. Since you're here today, you'll get a couple of emails from us. Thank you so much for being here. Again, I'm Liz Salmi. On behalf of myself, Director Kate DeRoche, and the rest of the team, have a great day.